有 Dr. Lay、Dr. Clarence Lay 在我们当中我们好不好？我们就用我们鼓掌来谢谢他，谢谢他抽空时间哦，抽空时间来到我们当中，那么跟我们分享一些关于到这个肾脏移植跟这个器官捐献的这个部分。那么现在呢，我们在开始之前，我们请中医弟兄来为我们做一个开始祷告，然后我们就将这个麦pass 给 Dr. Lay。
弟兄姐妹，让我们一起来祷告。天父，我们为着今天晚上，我们来感恩。第一，天父，我们感谢你，神你带领李长茂医生来到我们当中，来分享这个特别的课题。为着神你在他生命，在他过去的经历跟学习当中，你给予他的恩惠能力，今天在我们当中与我们一起分享，我们为这件事来向天父来感谢。天父，感谢你，因为你也透过教会让我们看到这一方面的需要，也让弟兄姐妹有这样的机会去聆听这样的课题。我们为着这一次这样的一种的机会，我们先生很感谢。为着我们今天在这里的分享，我们愿意把整个的时间从头到尾我们交托，愿神您与长茂医生同在，与我们每个人同在，与我们生理，我们在我们的心里，我们有担心有担忧的问题，我们都透过这样一个讲座，我们来对他有更深的了解，愿神的带领我们。谢谢天父，我们把这段时间完全向天父交托仰望，祷告奉主耶稣基督名祈求，阿门。
Thank you so much. I'm more comfortable talking in English, so you don't mind? Can? Okay. All right. So the topic that is planned for tonight is kidney transplantation and organ donation. Organ donation. I will talk for about only half an hour, and then after that we have some time for discussion. Okay. So my lecture will be from a Sarawakian perspective. That means the slides I show you is to do with Sarawak. And also maybe also from my personal experience. So instead of giving you things from the internet, it's a personal Sarawakian experience regarding this topic of kidney transplantation and organ donation. So I am a medical doctor. I graduated from University of Malaya in 1981. One of my younger brothers is Mr. David Ling's classmate. So I'm from Sarawakian, originally from Sarawakian. My father came from China when he was 8 years old. And we come from a very, very poor family. We stay in Atap house in Sarawakian, So I have no problem about telling where I come from, Not like some people, they say, oh, they are from somewhere. I'm a medical doctor. I'm a urologist. So my life for the last 40 years basically is regarding the urinary tract, the kidneys, and then the bladder, and then the tube from the kidney to the bladder, they call the ureter, and the bladder is here, and the bladder in the male patient is connected to the prostate, the seminal vesicle. This produces the sperm, and then we have the penis in the man, urethra in the female, and we got the testicles. And of course, all this must be connected with the nerve, with the spinal cord, with the hormones, with the brain. And of course, all this is under the will of God. So a lot of people think that, oh, I fix your tire for you, but actually God thinks that you're going to have an accident, So I fix your kidney, but God may not wish you to have a long life. So all these things is in connection together. Today I'll talk to you about the kidney. Another day I can come to talk to you about the bladder, the prostate, sex, fertility, the penis. So there are many topics that are of public interest in urology. Of course, I'm not so good in talking about this, Not so good about this. You are the expert in this. How common is kidney failure? There's a study done in Johor that says that it's about 100 per million. So Sarawak 2.5 million now. So now we should have about 250 people with kidney failure per year, new cases per year. All right. So we have a lot of patients with kidney failure every year. Why do we have kidney failure? The leading cause is diabetes, 40% diabetes. There's a huge group of patients in Malaysia called unknown. Sorry, I can't put about 30%. We don't know why. Because the patient come and see you, they already have kidney failure. And it doesn't make sense. The kidney is very small already, so we cannot biopsy and find out why. So maybe we think it's due to inflammation, due to infection, sometimes due to obstruction by stones, so many other causes. But the leading cause is diabetes. This is especially so in the Malay kampong. Sometimes the whole kampong, about 50% are diabetic. So diabetes is a very important cause. So diabetes, we can talk about it another day, but I'm not a diabetic specialist. Okay, so now I talk a little bit about kidney transplantation from the Sarawakian point of view. The first kidney transplant in Malaysia is a Sarawakian. This is the recipient. He had a kidney from the brother. They are from Bau, done in 1975, just before I entered medical school. So of course not done by me, done by Dr. Hussein Awang, the late Dr. Hussein Awang. He passed away already. So when I came back to Kuching, I visited him at home. So this is the recipient. He lived, his kidney lived, well, he lived for 31 years after the transplant. So he was not married. He got married, the wife, he got a beautiful daughter who is an air stewardess, and married a Dutch man. So I went to the house in Bau and I took this photograph. The kidney was used for 31 years. One day he was bitten by his cat. Then he got a severe infection and he died in General Hospital. So this is the story of kidney transplant. It started from Sarawak. I worked in GHKL as a urologist from I went there as a MO in 1984. From Kapit I went there and I worked there as a specialist from 87 until 95. So I was there for this period. So every year we do about 40 transplants, about 1 transplant per week now. So I did about 100 transplants when I was in GHKL over this period. So many of my talk is on these results. So these are the Sarawakians that were transplanted when I was in GHKL. Not many, but 4 a year. Not so many. So these are the patients. When I came back to Kuching to work, these patients come and look for me and talk to me, oh, you did my transplant long ago. So in those days, the transplants are usually from the mother. So the mother gave him a kidney, the mother gave her a kidney. So kidney transplant has been around for a long time. And also even in Sarawak. So this is from Dr. Claire Tan. Claire Tan is the head of nephrology in SGH. So she gave me the figures. So every year we have in Sarawak, every year we have a total about 100 transplants. 100 transplants. Most of the transplants in the beginning are from the living related, usually from the mother. Sometimes they are from what's called cadaveric. In those days we use the word cadaveric. That means the person died already and they donate the kidney. But very few cadaveric. 16, 5, maybe once a month. And a big chunk of them, almost 100, are from overseas. These overseas, at that time, during this period, refers to China. They go to China and have kidney transplant. But now, after the Olympic Games, I think China stopped it. So now they go to Cambodia. But the donor and the surgeon is from China. They go to Cambodia for the kidney transplant. So this is called overseas transplant. I have an interest in children, pediatric surgery. Yeah? So I do quite a lot of pediatric transplants. So I come back to Kuching, but I still go back to GHKL to do the pediatric transplant until pre-COVID. So we did 61 transplants over a period of 7 years, about 7 a year. That means every month I fly to KL and do a transplant. This is my good friend, Mullary Sundram. So because I'm a flying doctor, I cannot do the whole thing myself. So I work together with him to do the kidney transplant in KL. So the ages from 6 to 17 years. So even children can be transplanted. Usually, again, it's from the mother. But it's not harmless. We got 2 deaths of the 61 cases. And I make a report of this when we met with the Malaysian Society of Nephrology. So this is the kidney that we harvested from the mother. This is the operation. In those days, we do open operation. In other words, we make a big cut, take out the kidney and give it to the child. Nowadays, we do it by keyhole surgery. So transplantation, slowly, very slow, about 10 cases per year in Malaysia. Transplantation in children, pediatric in children, only about 10. So what happened to the other people? Some of them, they undergo hemodialysis. That means they take the blood and dialyze it. But children are very small. So if you take the blood, the child can faint, the child can die. So many of the children are dialyzed by PD, peritoneal dialysis. They put the needle into the abdomen and dialyze. So this is the pediatric, these are the children who got kidney failure. After COVID, they got few new surgeons in GHK, so I don't usually go back and do anymore, but the numbers are still very low, very small numbers, about 10 per year. But we have an increased number of so-called cadaveric transplant now. Cadaveric, that means patients who are already dead, patients who died, and then they donate the kidneys to the kidney failure patient. So number of pediatric transplants, but numbers again very, very small, very, very small, about 10 per year only. How is the transplant surgery? People think that, wow, surgery must be very complicated. But actually, most of the surgery are very simple. So for a patient who go for kidney transplant, this is the kidney. The kidney must have blood supply, right? Like the electricity, red color. So we have got arterial supply. The blood must come out, right? Venous supply. So we just connect the artery from the kidney, connect it to the human being, which you put on the leg here. Connect it to the iliac artery. And then the vein, connect to the iliac vein. Okay, so it's quite a simple procedure, So these are some of the pictures of the operation that I did when I was operating in GHK. Quite a red color when it's projected, quite red color. And then this is the kidney from the mother, huge kidney from the mother. The child is very small, so the whole half of the abdomen is the kidney. We do this surgery still nowadays in Malaysia by open surgery. We still don't do keyhole surgery for the kidney transplantation. And we use magnification, make sure that the sutures are very well done. Then the other thing we connect is to the bladder, so that the urine goes into the bladder. So actually there are only 3 connections. So the transplantation surgery by itself, for many conditions is very, very simple. Artery to the artery, vein to the vein. Then there's the ureter, the tube conducting the urine, that goes into the bladder. So surgery by itself, as a surgeon, is a very simple procedure. The problem is how to find the organs. Where are you going to get the kidney from? So this girl, she's actually a school girl. She's a tourist. She came to KL in 1992. 92, I was still full-time GHKL. I came back to Unimas in 1995 only. So when I was in University of Malaya, there's a minibus, the minibus, the famous minibus. So she was knocked down by a minibus, head injury. So we did a test on the brain. The brain is damaged. She cannot breathe unless we put on a ventilator. So the parents came from USA, and the parents said, we don't want to bring the body back to US. Please take all the organs you like. Take any organ you like. Then after that, they will cremate the body. But at that time, we could only harvest the kidneys. So I harvested both kidneys. I harvested around, by the time I finished, about 11 o'clock night time. And then we transplanted it into 2 recipients. This is a schoolboy, 11 years old, and this is the teacher. So this is called, last time we called it cadaveric transplant, but cadaveric is not a nice word, So now we call it deceased donor. The person is deceased, so if the person is dead, we collect the organs. So that's organ donation. So when a person's brain is dead, actually the spirit will leave the body. 他的灵魂就离开身体了. So the body, this body here is actually a dead body, but the heart is still beating. It's not breathing. But why is the heart beating? Because it's connected to a machine. So this is the idea of brain death. So brain death. So all over the world, we harvest organs from people who are brain dead. But when you go to the ICU, you can still see the heart beating. Okay, because it is maintained by all the drugs and the ventilator. So brain dead patients, they are going to die. Definitely they're going to die. Soon the brain will be gone, and then the whole body will be necrotic. So the brain dead patients are the ones who will look out for donation of organs. Most of them are like this: accidents, motorbike accidents, but many of them nowadays are because of intracranial hemorrhage, bleeding in the brain. Bleeding in the brain, why? Because of hypertension, high blood pressure. So every day on my phone, I will get messages that there's a donor in this town, that town, you know. So when there's a brain dead patient, the hospital will ask the family whether they want to donate the organ. And unfortunately, most of the time, they don't want, they do refuse. At first, when I came back in '96, I thought the Sarawakians are very open about this kind of thing, you know. But unfortunately, it is not. It is not. Last time we used to think the Muslims don't donate. We think that the Muslims don't donate. But now, actually, there's a national fatwa long ago. So the Muslims can donate. The Muslims can donate. All the religions allow you to donate, but the cultural belief, the family belief is another problem. So we have no donors in Sarawak for the last 10 years. Last 10 years already. We had some donors last time, but now no donors for the last 10 years. So this was in 1992. But this is not the first one. Before that, we had some donation. So this was the first one, 1990, first one for many years. We started transplantation in Malaysia in 1975. So not many donations from brain dead people, not many. So this was the last one we had in Sarawak General Hospital. So this is the team. I was here, and this is Dr. John Wee. He came from GHKL. This is in KBJ Hospital. These are the nurses from GH. These are the doctors from GH, including myself. This is the doctor from GHKL. So they come with a big ice box with all the instruments. They fly in, collect the organs, and they fly back to KL. This is on 6 August 2013. 2013, this is 15. So since 15, we have no donation in Sarawak. Okay, so I think this is probably the second one. This is the third one. So we have very few organ donations in Sarawak. So when we harvest the organ, we clean it. We clean it. We freeze it down to 4 degrees, and then we put in a plastic bag. Put in a plastic bag and send it for transplantation. This is the box I used when I was in GHKL. So when there's a call from me from Johor, I will drive down to Johor Bahru, harvest the organ, and drive back and transplant the organ. So I've done it for Johor, I've done it for Ipoh when I was working there. Now they tend to use ambulance to go because it's quite a long drive. So we keep it at 3 to 4 degrees. Not too cold, not too cold. Because if it's frozen, it cannot be used. So these are the deceased organs. Last time we call it cadaveric. So every year we have about 10, maybe 10. Heart, 1 or 2. This is last time, but now for the heart it's even worse. I heard they have stopped the heart transplant program. Liver, only a few every year. Lung, basically none, zero. So actually the organ transplantation program in Malaysia is very poor. Whatever I know Ibrahim say, whatever the minister say. Okay, so it's very poor. What about the transplant? Is transplant a guaranteed success? So if the mother or father give the organ to the child, is it a guaranteed success? So I studied the first 10 years. I studied the first 200 cases when I was in GHKL. First 200 cases, I look at all the record and see what happened. So actually, there are a lot of complications following a transplant. A lot of complications. The commonest complication is infection. In English, called sepsis. Sepsis. That means the patient got infection. That's why during the COVID pandemic, we stopped doing kidney transplant in Malaysia because the immune system is down when the person has a transplant. Well, why is it down? Because we give them medication to prevent rejection. The other big problem is of the 200 cases, 66 of them, that means like 1/3 of them have got rejection. That means the body reject the organ. So it's not harmless. It's not harmless. And of course, when we do surgery, sometimes there are technical problems, right? Even if you repair the car, there are technical problems. Sometimes there's leakage, sometimes there's a blockage. So these are the surgical complications. But the result overall with intervention is very good. So 1 year survival is 94%. So if you donate a kidney to your child, at the end of 1 year, 94% the kidney is still working. 5 years is almost 90%. So the result is very good, but it's not without problems. It's not like you go to hospital, the mother give the kidney, take the kidney, put into the child go home happily forever. It's not like that. That probably only happens if it is a twin. Twin. In other words, the twin number 1 give to twin number 2. The genetic is completely the same. That can happen if it's a twin. So some people, they transplant, they go to the jungle, stay there, don't want to come and see anybody, don't want to see doctor, don't take medication. But that is very rare, very rare. Okay? So that's kidney transplantation. What about the donor? If you choose to donate a kidney to your now we can donate to your girlfriend, your wife, or no husband, whatever. So what is the risk for the donor? We have one death. We have one death during the operation or immediately after operation in GHKL. One death. So we cut off the kidney and then we tie the artery. This particular woman, the suture came off. So she bled to death in the ward. The nurses did not pick it up in time. So after that case, all the patients go to ICU after operation. You may think that this doesn't happen, this only happens in Malaysia, but in Singapore, the same thing. Singapore also quite a few cases. They use keyhole surgery, they clip the artery, but when the patient got back to the ward, the artery fell off, The artery fell off, just like you staple your paper, right? You staple it, then you bring to the class, some of the paper fall off. Long term, there are no significant problems. They use the word significant, doesn't mean there are no problems. So if you donate one kidney, if you have a family history of diabetes, if you have infection, then there's a risk that the donor can also get kidney failure. Okay? They can get kidney failure. So ideally, we try to avoid donation unless there's no choice. And of course, a lot of people in Sarawak have no choice. A lot of people in Sarawak have no choice. That's why that little boy, the brother gave it to the elder brother. Because otherwise, the brother will die. Because they have no choice. So we have so much kidney failure every year. Every year, we have increasing number of people going on dialysis. But the number of transplants in Malaysia are not increasing. This is 2019. 50,000 patients on dialysis. 40,000. Now it's 50,000. So we got a lot of patients on dialysis. If you go to any dialysis center in Kuching, Sibu, Miri, Bintulu, almost all the centers are full house. Even if you have money, you cannot be dialyzed. You cannot be dialyzed. So we got a lot of kidney failure. So before I came just now, I went to find out, because I think I should tell you a bit more about hemodialysis. Hemodialysis means they take the blood from the body, put the blood into a machine. The machine try to purify it as much as possible, and put the blood back into the machine. So I went to the clinic, the dialysis clinic next door to me. In normal hospital, the dialysis, the nephrologist and the urologist, we are in the same place. So I went there and I tried to entice him. I give him a present. Look at him very carefully. He's holding something on the right hand. If you can tell me what it is, I will give you the present as well. So I gave him a present. And then I said, can I take a photograph of you? He said, okay, boleh. So this is the patient on dialysis. Blood is taken out, go into a machine and come back. He can drink, he can eat, he can look at the YouTube, but it takes 4 hours of your life. So it's, and the blood, if you stick a needle into your vein, you don't take much blood unless you stick into the neck here. So what we do is that we connect the artery to the vein. It's a minor operation. It's called the AVF. We connect it so that the vein becomes very big. So when you stick the needle there, a lot of blood will come out, so that it can be dialyzed. It's still 4 hours. So 4 hours on the machine is a tough life. My own brother-in-law was on dialysis for 30 years. My brother-in-law, that means my elder sister's husband. Initially, when she was in Miri, there was no dialysis center. So we have to buy the machine for him. He dialyzed at home. So it's a lot of money. That's why most people in Sarawak, I would say most of the third world countries, if you have kidney failure, you have no choice. No choice means you're going to die, basically you're going to die. That's what one of my sisters, the nurse, tell the patient, 你不死你就死了. So she got very angry. Okay, now in children, or in people who got a poor heart, we cannot take the blood out for dialysis. So we do what's called peritoneal dialysis. We put liquid into the peritoneum, into the abdomen, keep it there for 1 or 2 hours, and then let the liquid come out. So that's called peritoneal dialysis. And again, peritoneal dialysis is in Malaysia for a long time. This was the 10th anniversary. I just joined. There's me last time, very fat. Right? Last time I was very fat. So there's me. I think that's probably 1991. This is Tan Sri Abu Bakar Sulaiman. He is a kidney specialist. So he started this program of dialysis for Malaysia. So in Malaysia, if you have a government servant connection, the son, the father, mother, whatever, you will get free dialysis in Malaysia. He started this program, Tan Sri Abu Bakar Sulaiman. Either peritoneal dialysis or hemodialysis. And the government also, under the previous minister, says that the government will sponsor 1/3 your dialysis, 1/3. But you must find the other 2/3. So if the dialysis costs $180, the government will pay $60. But you must find another $120. So how are you going to find $120 if your whole month's salary is only $1,000, right? So it's very tough. So that's where the NGO, the church come in. So the church will say, okay, or the Kidney Foundation will come in and say, okay, I give you $60. But you must find $60 from somewhere else. Family member, whatever. The concept is like that. Singapore National Kidney Foundation also, same concept. Because if you cannot find any money at all, you cannot walk, nobody look after you, you're half blind, then it's probably not good idea to dialyze. Of course, that decision is up to God, your life is up to God, but it's probably a logical decision not to treat kidney failure if you're not productive or you have no resources at all, at all. So this thing of organ donation is a responsibility for the government, So we have very few donors in Sarawak for the last 10 years. So Sarawak General Hospital, this is the entrance. The Maybank machine is here. So as you walk into Sarawak General Hospital at the entrance, they are right at the entrance. So the office is right here. Organ hospital, unit perolehan organ hospital, but they have not got any organ for a long time already. So they gave me these leaflets if you're interested in these leaflets. So this is Dr. Uma. Dr. Uma, she is the medical officer in charge of these nurses for organ donation. And these are the organs that can be harvested. The skin, the bones, the heart valve. Heart valve kucing, I think we only harvested 197. I harvested from GH. Heart valve. The cornea we're harvesting for a long time. Cornea can be harvested even from the mortuary or even from the home. If somebody died at home, they can still donate the cornea. The heart, the lungs, the liver, the kidneys. So traditionally, usually it's the kidneys. So this is the one in Bahasa, Malaysia. If you collect an organ and put inside a plastic bag, like somebody chop off your penis, and you put inside a plastic bag and bring it from Muka to Sibu to Kuching, of course the thing will be dead. It's dead. So you must keep it cool, 4 degrees. And even if you keep it cool at 4 degrees, the liver and heart will last only 4 hours. 4 jam saja, 4 hours. So most of the heart lung must be transplanted in the same locality. The kidney can last 48 hours. 48 hours. So the kidney can be harvested from Kuching and sent to KL, or even sent to Singapore, or even sent to London. I think I can even send to London. So in USA is one country. USA is one country. So they have an organ sharing system. Because sometimes you cannot find the correct tissue type, You don't have the tissue type, but maybe there's another person somewhere else with that tissue type. So the organ can be sent to another place. In exchange, I owe you. So maybe New York give you one kidney to San Francisco, maybe next year they'll return another kidney like that. So there's organ sharing. So organ sharing kidney is no problem. Bone usually is kept in the bank, but we don't have the bank in Sarawak. So they send to USM. So they keep in the bank, and then when somebody needs bone, they can use the cadaveric bone for limb reconstruction. So all the organs can be donated. Can be donated. These are the organs, and when they're donated the organ, the surgeon will stitch back everything nicely, like surgery. So the body is not disfigured. Okay, I'm coming to almost the end of my presentation. So I went there. I went to the place. I said, would you like to come to this gathering? He said, no, you go first, see how is the response. But they're happy to come. This team of people are happy to come, just like blood donation. They're happy to come to your church meeting, whatever, to see whether anybody pledged the organs or not. But pledging an organ is only one part of the story. When the person dies, he's dead, right? He cannot give consent. And he cannot give consent before he dies, right? Because he don't know when he's going to die. Suddenly accident or stroke or whatever, So we still need consent from the family, the next of kin. And very often the next of kin is too unhappy, too sad, they cannot give consent. So what do the Singaporeans do? Singapore have a law. When you die, your body belongs to the government. That's called the opt-out law. Unless when you are alive, you sign, I don't want to donate my organs. That's called the opt-out law. They have a directory. They look at the directory. Oh, this one, Mr. Wong Ting Chung. Okay, last time he said he don't want to donate. Okay, don't touch his body, cannot touch. Okay, so it's called opt-out law. So in Singapore, if you must be a Singaporean, Malaysian accident, never mind. So if you're a Singaporean, you have an accident in Singapore, your body belongs to the government. Okay, so the government can harvest your organs. But usually they talk to the next of kin. But because the law is so strong, most of the next of kin will not object. In Malaysia, even if you sign a donor card, quite often the family will object. Usually Malaysians, we are family, kan? So sometimes there are 10 of us in the family. So quite often the grandmother said, no, beside. So if somebody say like that, of course, eventually people will not agree, like, kan? Unless there's some very strong member in the family. Okay, he already said he wants to donate, so let him donate. So quite often we have this problem. The family often indecisive to donate, even though the patient may have carried a donor card. How to become a donor in Malaysia? Last time we carry a card, now no more card. So now you want to donate, you just go to the website. You want to talk to somebody, you can call the GH. But unfortunately, they don't want to give me their handphone number, so they give me this number. Or you can email to them. And as like all government departments, they only work during office hours. But you can contact this handphone number if you like, if you're interested in any of these things I've discussed today. So this is my last slide. I want to end by saying that another important function is nutrition. What you eat is very important for everything in life, especially the kidneys. So the kidney is important for removing waste products. And where the waste products come from? They come from protein. So a nutrition good for the kidney is less protein, especially processed protein, and less potassium. Potassium is found like things like banana, coconut water, especially if your kidney function is not so good. Phosphorus, especially things like Milo. You take a lot of Milo. My partner in Norma is Dr. William Chow. Every day he'll be shouting at patients, you don't take Milo. Milo is no good for you. Okay, so Milo, and then salt. I think Sarawakians take too much salt. They just put salt in everything. So salty. So salt is a strength for the thing. And water intake. You must drink enough water, but not too much water. Okay, enough water means about 1.5 to 2 liters, not 10 liters, unless you play golf. Play golf, then you drink more. You must produce, a normal human being must produce 1.5 to 2 liters of urine a day. About 1.5 liters of urine. Don't drink too much, don't drink too little. But most people tend to drink too little. So where there's a will, there's a way. So this little boy, kidney failure. The mother looked after. Peritoneal dialysis. After that, the mother donated the kidney. So I did the transplant for him when I was in GHK. So the treatment is available, but it's not so easy. It's not so easy. It takes a lot of time and effort. What else I want to say? I think that's about all for my lecture, but I will be happy to discuss with you, either in English or Mandarin or Fuchao or Hokkien or whatever. 谢谢你们. Any questions? This for today, but if you want to ask me other questions, also fine. Because I used to lecture at the Kidney Foundation, So other topics of my specialty are the bladder, the prostate. Prostate cancer is very common. And then about having a child and fertility and sex. And passing urine at night. I'm not so good in this part, not the church part, I'm not so good, okay? My church is St. Thomas Church, I go to St. Thomas Church. We run a free clinic there last time, now we stopped already. No questions? Please ask me a question, otherwise I feel very disappointed.
Those on the dialysis, the 4 hours, today, why they didn't do it 3 times a week? Can they do it once a week?
The answer is no. Because even 4 hours is not good enough. Even 4 hours is not good enough. Unless they have still fairly good function. But if you have fairly good function, then they don't need to go on dialysis. They don't need to go on dialysis. I know what you mean. A lot of people have that idea. Why don't I dialyze once a week or twice a week or something like that, The answer is no. It doesn't work that way. So even you're traveling, you're going to holiday in Singapore, in China, you can go to the local center for dialysis. You can go to a local center for dialysis. So where's my dialysis? So this is on the machine, 3 times a week. The one in charge is the nephrologist. I'm a urologist. That means I'm a surgeon. I operate. So dialysis under Dr. William Chow. I took a picture from his room just now. William Chow. So they are the kidney specialists like Dr. Simon Wong, William Chow. Usually we don't have patients who are dialyzed once a week. We only have one patient who is dialyzed once a week, and that's because she is a psychiatric patient. So she doesn't want to be dialyzed. So very difficult to force her, right? But there are many ideas of different machines, this or that, but so far all that is under research. All of them require dialysis 3 times a week, 4 hours. Almost all of them. To be worth the while. Just alang-alang, you dialyze once a week, You don't remove all the waste products. Even then also the machine quite important. The type of machine you do also quite important. Just ask me any question. Okay? Hui Chang Hui. 为什么知道肾有问题哈 Okay, that slide I took out because I don't want to become a nephrologist. So usually they start with bubbles in the urine, leg swollen, extra fluid because the body not produce 那个水分太多了咯，喝水了就肿起来了 ，face swollen. Okay, so the body cannot remove the water, the kidney cannot remove the water. So the treatment is try not to drink too much. Starting after that, of course, in the end dialysis Then the waste products not removed, so the face becomes yellow, become dark, then become very itchiness, and then they feel like vomiting because all the waste product they vomit, they cannot eat. So these are all the indications of kidney failure, and then they will require dialysis. But the actual decision to dialyze is the nephrologist, is this guy, because once you start dialysis, it's a lot of money. It's at least $200 per session. 200 times 3 times 4. So it's a lot of money. And if you go to the normal medical center, 90% of them are the government dependents. So it's a big decision for the doctor to make because it's a lot of money for many years. So to decide on dialysis is the nephrologist's job. They have to certify, sign. And not only they have to go to Gamma Hospital for Dr. Claire Tan to sign as well, because it's a lot of money. So there are very clear indications. The other thing is the heart. If the waste products, then the heart will stop. The heart will irregular heartbeat. Then it becomes emergency. You have to go to emergency, and then they put the line and dialyze. So 他的身体肿起来了，身体会肿起来，皮肤会痒，会呕吐。还有思想又会乱一点呢 ，because a lot of toxin 呢，很多毒素在肾里面没有排出来。 100 per million 啊，所以大约每年有250个人有肾坏了，250 per year in Sarawak. And I think most of these people, they just die. Most of them will just die. Most of them. Because it's so expensive, right? It's so expensive to dialyze. Most people cannot afford the dialysis. Mr. Yong, thank you. 保险呢 You mean insurance, is it? Insurance, it depends on the type of insurance you buy, how much you pay. Usually it's one lump sum, like say, okay, dialyze for 2 years or 3 years. A lot of insurance don't cover long-term dialysis. I know because I've been working for 40 years. So insurance, usually they give like critical illness, they give you 200,000 finish. You know, like you got cancer, they give you 300,000 finish. So usually insurance not enough for lifelong dialysis, not enough for lifelong dialysis. And then the Social Security, EPF, you can withdraw money for the dialysis. SOCSO will dialyse you, SOCSO will pay $120, not enough. SOCSO pay $120, you dialyze until you are 65, I think. There's the SOCSO law, there's a law there. But you must have contributed for at least 9 months. So if any of you is working, all your employees, please register with SOCSO. You must register with SOCSO because the benefit is for dialysis. $120 until you're 65. Even though you already got kidney failure, you can still register. After 9 months, you can make use of the benefit. So SOCSO is very useful. So make sure that all your employees or yourself, make sure you have a SOCSO number. I'm 68, so no point already. Too late already. And then my wife is a teacher. My wife is a pensioner, so I can use the government connection if I need dialysis. 是不是这个问题，还是有别的问题？啊。OK， so 你意思是说有没有药吃了，肾会恢复正常呀？没有这样的药 ，no such medicine。啊，很多病人说哦。我看这个 Dr. Wong 看 Dr. Lee 了 Dr. Lai 了，我吃药了，不用洗肾，没有这样的药。但是他的药怎样？他药是可以预防 ，you can prevent but not reverse， 可以预防。说预防怎样预防？第一个是饮食，第二是血压高，must control the blood pressure，must control the blood pressure。大多生病的人都有血压高。大多生命有血压高，所以you must control the blood pressure. So 马来西亚血压高the control is very bad, very bad in Malaysia. 血压低 good. 我爸爸血压低，我也是血压低，我爸90多岁了。没有，你血压低真是 you must have no symptom. 没有什么现象的，不要买หิน啦，你看呢？you must have 血压低生病大多是血压高。如果你有生病 confirm 有生病，你血压低就不好了。Let me see where is this one causes of kidney failure. I thought it's in the beginning just now. 这个 slide, this slide, yeah. So 我们马来西亚就是糖尿病这个问题。我天天看见病人糖尿病，他的妈妈糖尿病洗肾，我叫他你不可以吃糖不可以吃太多那个 goreng 的，大多是马来人，他不相信。过了10年，他也是洗肾，所以。Sugar very important. 我 我们要改变我的脑下，不要说我没有糖尿病，不可以讲我没有糖尿病，明明是糖尿病20多 sugar 就是讲糖尿病了，但这个是糖尿病可以改善的，不是说你 forever 吃药的。糖尿病 exercise 运动吃的东西小心，不是说不可以吃东西，改变吃东西，吃鸡蛋啦、fish 啦、牛奶啦，是吧？不要吃太多面菜，那个 carbohydrate 啊 carbo。说这个最重要，有时候有些没有办法就吃药了，就是吃药没办法。验什么？糖尿病、生病的验血而已吗？maybe 20块，$20 only。The renal profile。就验血就知道了。Creatinine and EGFR。那个是你如果小便泡泡太久，就会有生病了。有泡泡有 protein 呢？看看为什么有泡泡？有时候有泡泡没有 protein 的，有没有蛋白质的？如果你小便很多蛋白质后来就会肾会坏掉了。验血验尿 ，very easy one。还有一个这个你刚才问我是什么药？有些人肾丝头肾结石不要医，或者是没有钱医Sarawakian a lot of Sarawakian got kidney failure because of this。两边肾丝头，没有钱，去政府等很久，政府医生对你没有兴趣，他要做别的东西，所以很多人 is a pity right 4%， 在美国 only 0.1%，but in Malaysia 很多病人为了肾丝头肾结石会肾坏掉 ，blockage 那个是。可以避免的。Just remove the stone, no problem already. Mr. Yong, come. A few more questions. Can got time. The urine test 尿应该全部 negative 啦。如果有 glucose, protein, nitrate, blood 就有问题了咯。So check the urine is very cheap, only $6 only. $6 urine test. Go to PEF lab. Urine test $6. Make sure no sugar, no protein, no blood, no leukocyte. Okay, every 6 months. 不用花几百块，不用做那个什么 tumor marker 啦，什么一大堆不用，就是做 urine test, kidney function, blood glucose, and cholesterol 啦 and cholesterol.
Yes. Have you ever considered getting the transplant? Is it possible to get the organs from animals like or do you ever try?
Malaysia we have not tried before, but they have done it in Cambridge and London. They have done it already. They have already done it. The closest animal. Yeah. Okay. No, bovine. Porcine. Pig. Porcine. The closest animal to human beings is pig. So they have done it in pig. They have transplanted from a pig to a human being. But it cannot move in the big scale because the animals got their viruses. Animals got viruses. So those viruses can kill the human being. Just like if we are going to say there's a guy in Kapit, he wants to donate the organ. The brain dead already. We want to collect the organ from Kapit and bring to GHK for transplant. We have to screen the donor for HIV, for dengue, for VDRL, for hepatitis B, hepatitis C. So many viruses we have to screen. And even then also, we cannot guarantee the recipient that there is no viruses inside. So the biggest problem is the virus. The viruses found in the animals, which don't kill the animal but kill the human being. 就是这个问题咯。Yeah.
Does it mean that because over time the kidney transplanted will fail eventually?
Yeah. Fail. That's why even the first transplant after 30 years they fail. They fail for a number of reasons. One reason is rejection. the body reject 哦，这个不是我的嘛，这个是我弟弟的嘛。They reject. And then the other thing is that we have to give all the recipients toxic medication to suppress the body system. So they're taking all these chemicals for 30 years. So after a while, they also got cancer. They got lymphoma, leukemia, prostate cancer, liver cancer. So the recipient, eventually they die off from rejection, from infection, from cancer. Infection, sometimes they're careless. The man was bitten by his cat. His cat bite him. Then he leave it alone. After 5 days, he went to Kuching GH. He's too sick already. His blood pressure dropped already. That's why he died. Died from the cat bite. Of course, many of them die from cancer, like breast cancer, cervical cancer. So that's why try not to have kidney failure. Transplant also a problem. Dialysis also a problem. And the biggest culprit in Malaysia is the diabetes. Yeah, David Ling.
Is there any limit for donation of kidney? For example, any healthy one can donate to anybody? Is it like that, or must be related?
Okay. Anybody can donate. Anybody can donate. And anybody can receive. The problem is how to mesh it. So if I want to give to my girlfriend, then they have to go to a committee, go to a committee in the Ministry of Health. Why this person your girlfriend? You give her money? Cannot. So girlfriend, they have to establish. If it is to a legally married wife for X number of years, then okay. So you can donate to a proven relative. So in Malaysia, a lot of the relatives come from China, They come from China, one is linked, the other also linked. But after you check, actually they're not linked, they simply fake the document. So this commercialization. So that is the legal aspect of it. So in Malaysia, some of the doctors, even in Singapore, some doctors go to prison, go to jail, because they participate in this, they call it the organ trade, trade of organs. It's supposed to be illegal. Then the other question is whether the organ is good enough or not. So if I want to give to my wife, I have kidney failure. My kidney function is borderline. So if I give her one kidney, I will left with half. So I may not live so long. So the doctor will say, I cannot take your organ. Not fair for you. And then the recipient doctor will say, hey, this kidney like that, alang one, maybe she used only for a few years, so also not fair. So first we assess the kidney function. Of course, the most important is, I mentioned earlier about the infection. So if you got the infection, your kidney function is no good, or you got cancer. Say if I got lung cancer, I want to donate my kidney. Cannot, because in your kidney got blood. The blood would have cancer cells. So if I donate to give to the person may have lung cancer. Unless your cancer is considered cured, like you got skin cancer, you chop out the finger already. After 2 years, nothing happened, can. So if your cancer is already cured for a few years, then you can donate. The most problematic one in Malaysia is diabetes. If you're diabetic, if you have a strong family history of diabetes, in other words, father, mother diabetic, the chance of your diabetes is almost 100%. So if father, mother diabetic, you cannot donate. If you are diabetic, you cannot donate. But hypertension can. Dyslipidemia can. Heart is another problem. We have got a lot of heart disease in Malaysia. So if you've got severe heart disease, you cannot donate because you may die during the operation. So we don't want to kill the patient by subjecting them to an operation, unless it's a very minor thing. Same with recipient. If recipient is very high risk, they should not receive the organ. They better go on CAPD, peritoneal dialysis. Very, very mild. Put a tube in, just put in fluid. So it's a very sad story, not a good story. That's why I didn't want to be a nephrologist. All the patients die in the end.
Your friend who actually went to China, what is your advice on this? Because there is no proper, sometimes like, for the kidney may match, because they can't find any kidney here. What is your view? What is our view as population?
Okay, so it's illegal. First of all, it's illegal. It's illegal. In other words, the doctor, the nurses can be put in jail. And last time China did not enforce it. But pre-Olympic game, China said, we enforce it. So now if any Chinese doctor is caught doing this, he'll go to jail, or he maybe even be executed. Malaysia, Singapore is always illegal, never legal before. I think the only country may be a little bit legal, maybe Iran. Maybe Iran you can buy, Iran. So most countries illegal. So when it's illegal, it becomes very problematic. So patients who go to Cambodia, for example, because Cambodia, somehow, I don't know, the policemen, I don't know what happened. So they will bring the donor from somewhere, the patient from Malaysia, the surgeon from China go to transplant in Cambodia. But because it's still illegal, the moment they transplant, they say, "Ni hui jia, you go home." So they land up in Kuching. In Cambodia, there's some urine coming out. But when they come back to Kuching, no urine come out. Because there are so many complications. There are so many complications. So the money gone already. And the worst thing is that the money, most of the money didn't go to the patient, the recipient. They get something like maybe 10,000 ringgit only, the amount of money that the recipient get. So it's very sad. So generally speaking, it's not encouraged. The other problem about Malaysia is like that. For a long time, Malaysian government said, you go to buy a kidney, Malaysia will not pay for your treatment. Because the medicine is very expensive. The medicine is more expensive than dialysis. All the medication for transplant, more expensive than dialysis. But of course, the patient is happy, no need to lie down 4 hours, 3 times a week. They can go to nightclub, they can have girlfriend, they go here, go there, No need to lie down at the machine for 4 hours. So a lot of the rich people, they go to buy a kidney. But it's, generally speaking, not recommended. Not recommended. But sometimes you got no choice. You have no choice. Some of the patients got no choice. They got no donor. They don't feel like lying down 4 hours, 3 times a week. Their abdomen is full of appendectomy. Operate here, they cannot go for peritoneal dialysis. So they just find the money and somehow they make some arrangement at the table to have a transplant. But very few nowadays, maybe 2 or 3 a year only. Last time, plenty. You saw the Clarence slide. Plenty last time. For long, they go to China to buy a kidney. Now it has stopped. No more there. When I was in GHK, they always go to Bombay. They go to India to buy last time. Last time they buy it from India. See, this is from Dr. Clayton, HGH. So we got so-called overseas transplant. So many. Even now, we still got probably about 100 of them. But transplanted last time, not new ones. Patients who go to Bombay, I did a study last time, and 1/3 of them come back with HIV. The transplant in Bombay, that's 1991, 92, like that. Those few years, I surveyed all of them. 1/3 of them come back HIV positive. What Chang say, right? That time, now okay, now HIV can be treated. Now it can be treated. So buying a kidney is not good. The best is, of course, to develop our local program. That's the best. But it's not moving. Not moving. So I'm quite happy to come and talk to you about transplant. So hopefully, But if you have got a cancer, if you have got diabetes, no point, because you cannot be a donor. Once they check your background, they won't accept your kidney already. Or you have got kidney impairment. 如果你肾不好，也不能够捐肾。Okay. Thank you. Time's up. Bye bye. Thank you so much.
谢谢 Dr. Lay 所以今晚也 very interesting， 学到很多新的东西，很多新的知识。然后 Q&A session 也是让我们又重新学到更多那么作为结束，那么今天我想邀请中医弟兄可以上来，我们有一个小小的礼物要给 Dr. Lay 所以我们请中医弟兄来跟我们颁OK， 来叫大家的配合，来掌声。好，谢谢
天父，我们感谢你，因为你透过这样的时刻，让我们对我们自己的身体有多一层的认识，对这个 kidney 我们有多一层的认识，甚至对这个 kidney 的这个移植我们有多一层的认识。谢谢天父今天的祝福，也求神继续带领弟兄姐妹。我们特别也神的祝福长毛医生，愿他在接下来的日子继续在这个医疗上继续的为人民为人民来服务。我们谢谢，我们求神继续祝福他，也祝福弟兄姐妹在回家的早中求神保守，让我们回家都平安，愿神看顾。我们愿意为着今天我们再一次向天父来感恩，谢谢天父赐给我们，也赐给我们这段时间祷告，奉主耶稣基督名祈求，阿们。